It's another time to engage. So let me know where you are watching from as soon as you come in. It's a very pleasant and beautiful morning on this side. It's always good to be grateful to God and uh, feel alive, and not just feel, but know that there is a commitment that God has towards each and every one of us, and for the gift of each new day, we must learn to appreciate God. Gratitude is key. It's actually an essential aspect of life. Has a way of helping with your mood, and of course, it helps to position your mind correctly. Let me know if you are good with the lighting and the audio as soon as you come in. So don't just scroll past. It's a time for everyone that may be uh, online at this time, everyone that's able to connect, to come live, to join in on this live. So let me know where you are joining from as soon as you're able to join in. I know that we're in different time zones, and because of that, I'm sure that some people are definitely asleep at this time as people are waking, while some are in the evenings, night, depending on your region, depending on your time zone. So I want to welcome everyone who is joining in. Welcome. Just let me know where you are watching from. Where are you joining from? Kindly indicate in the chat. Oh, first to join in. Eton Overt. Welcome, Eton. Hey, good to have you here. Thank you, everyone. Thank you for joining in. Please double tap on your screen to like this live. Oh, thank you for the emojis. Welcome, everyone. It's another time to engage with members of the community. And if you are watching for the first time, coming across this channel, uh, this is a health, wellness, and lifestyle channel. And you can be sure to engage with people who prioritize their health. And I'm sure you've heard that before, that health is wealth. And really, it's a major part of your wealth. Health. Your health is a major part of your health. There's no doubt about that. Okay. How much can you do with a weak body? How much can you go, whether in your career, your business, as a family man or a woman, even as a student? How much can you do with a weak body? In fact, your health is not just about your body, also about your mind. So, if you are talking about a complete person, a complete individual, you should be talking about your physical, your mental state, and even your spiritual side, life. Very important. So, I want to welcome you once again to this live. Thank you, Ovat, Poklock, Neil Mires. Thank you. Cesare, Mohamed Igod, Tommy, Tommy, good morning from Sweden. Wow, it's so good to know. Thank you. What time is it in Sweden? Tommy, I'm not sure I can pronounce. Is it Jostrom? Sostrom? Hope I got that. Thank you for the likes. Thank you everyone who has liked the live. Please double tap on your screen or look for the like icon uh, to click on it, and that way you will be supporting the channel, and more people will be able to join in. All right, so I want to welcome you once again, especially if you are joining in for the first time. If you have never been on my live, I mean, it's a special honor, special privilege that I have to be connecting with you, uh, whichever part of the world you are in. So I want you to also subscribe to the channel so that we can remain connected, and you can have regular interactions with me. So I have dedicated this session for question and answer. And if you look at the title, there's something about um, hypertension, high blood pressure. Any difference? What is the difference? Okay. And I must let you know that I'm quite passionate about your health, about you getting the right information. As a medical doctor, I believe that um, getting the right diagnosis is a major uh, way to even start with management of any condition. Is the first big step to recovery. Okay, where there's no diagnosis, there's really nothing that we can talk about in terms of treatments. We can talk about treating symptoms, but we cannot talk about hitting the nail on the head. All right, so I welcome you once again, Tommy, uh, from Sweden. I'm not sure I've seen anyone join in before from Sweden. I have people from Belgium, people from the United States of America, South Africa, of course, Kenya, India, Nigeria, people from different parts of the world, Germany. All right, so thank you, Neil, for your comment. Neil says you're a great guy. Thank you so much. I appreciate, and I really want you all to subscribe to the channel. And interestingly, it will be 4 years this month that we've been on YouTube uploading videos and helping the world to learn from the professional side. So thank you, Neil, for your comments. Well appreciated. Neil Mires, where are you watching from? What part of health do you deal? Okay, Gary, do you deal with? Yes, thank you for the question. I I deal. Okay, let me say I am a medical doctor, practicing for over 10 years now, and practically a family physician. So I engage uh, people from the cradle to the end of life. Okay, so but that involves management of individuals and families for health related challenges. Of course, I am passionate about management of chronic medical conditions like hypertension, diabetes, and then reproductive health, family health. So those are the areas that I am focused on. And of course, mental health. These are four major areas of interest. And I want to say that you will be finding videos related to these particular areas on the channel. You will be finding them. Okay, Neil Mires from the United States of America. Yes, I know it's evening, the night now in the United States. And interestingly, I keep saying that I appreciate uh, a lot of members of the community here. who are Americans, who are they may not necessarily be Americans, but they are based in America. Okay, so I have a number of people who join in regularly from America. So I know it's a good time to actually connect, being for people who are night who sleep late, and then are early risers. All right, so this is a good time. So I'm from Lagos, Nigeria. Neil Mires. Neil says, of course, there are some messages I'm not seeing because YouTube is removing some of them. Okay. Oh, Neil says, I like learning about my health. Very good. It's a great one. We cannot but I must mention the fact that this is one thing that every one of us has to deal with. Every one of us, uh, it's just common that we just have to, no matter your race, no matter your gender, no matter your status, no matter your career, no matter your profession, we all have to do with this health. And I'm sure you've heard that before, that health is wealth. Okay, is a major part of your wealth. So how much can you do uh, with heal health? So, but we are doing this to ensure that we are keeping ourselves updated, that we are updating our knowledge, and then we are encouraging one another to do the needful. Recently there are some statistics. I'll be uploading a video soon on longevity, how people get to live long. Who are those that get to what are their practices? Okay, can you as an individual begin to do things that can help you to even live life longer than you would have if you didn't get involved in those practices? All right, so I believe that we have a lot to learn together. So thank you for the likes. I can see we have 5 likes right now. All right, so I am quite encouraged by the responses and the engagement. So let's keep it coming. I can see that there are some questions already coming in. All right, so we are here to learn. Neil, it's a good one. Neil says, my mom and dad work at the hospital. Wow, interesting. So, Neil, they work as what in the hospital? Wow, that's interesting. So, we have Chima S. Amadi. Wow, good to have you here, Chima. Chima says, Sir, my knee is hurting me. So, what's the problem? Now, I must say, as a disclaimer, that even though I'm a medical doctor and I can provide you with information, the general and, of course, professional information from my knowledge and skill. Okay, but um, we can try as much as possible to explain, to answer questions, and there may be a need for more personalized interactions. So there is actually a link in the profile, a WhatsApp link. If you're on WhatsApp, you can join that group, and I can provide some more personal information for you. Okay, so Chima, where are you watching from? All right, me hurting you uh, could be due to a number of reasons, many causes of knee pain. All right. And the fact is that your knees are also an important part of your body. Okay. They carry weight of the upper part, and they also help in your movements when it comes to walking, as it's connected to other parts of your leg. So if you are having pains, I can imagine what that means. Depending on the level of pain, that may affect your mobility. I mean, it may not completely affect your mobility, but may limit how much of walking you can do, how much of work activities that you can do. Imagine if you are even involved in a career or profession that requires you standing, or using your legs to do some work, to get some work done. There are some limitations. So it could be from a trauma. Have you had a trauma before? I mean, the recent time leading to this. Okay, I want to ask, when did it start? You know, any swelling, and that pain, is it limited to the knee? Is it just one side or both knees? Can think about so many factors. Could- Will it be an infection? I want to know about your genotype and also your age. Your age is very important because with increasing age, there's a risk of developing arthritis. And if you also um, are on the big side, maybe you're overweight or obese, I want to find out your body mass index and be sure that you are not having more than what is required for your health. Um, because being overweight or obese puts an individual at risk of arthritis and some other medical conditions. So these are very important questions that we can only get to interact better on a personal note. So you will actually need to see a doctor. Have you tried over-the-counter medications? How long have you had this pain, and what have you done so far? Have you had any previous medical treatment? Have you been diagnosed of arthritis before? Have you had any surgery before? Are you on certain medications? So we need to check. It could just be normal musculoskeletal pain that may respond to analgesics, and that prescription will be better received from your doctor after a proper evaluation. All right, your doctor, your physician may decide to run some tests, investigations to help to identify the cause of the pain. So if you need to do something. I don't know where you are watching from. Chima, are you still there? I don't know where you're watching from. I can't seem to find um, some messages now. Okay. So, but let me know if you can still hear me. Let me know if you can still hear me. Chima, let me know if you are still there. So, if you thinking of a solution, if you have tried different options, may have even tried home remedies. Of course, some home remedies will work, like maybe applying an ointment, menthol, anti-inflammatory substance. May also benefit from, apart from using oral analgesics, you can benefit from use of turmeric, regular intake. These have anti-inflammatory properties. Um, Also, ginger, garlic. These are natural substances, and all this should be guided. The use of this should be guided, because if you have certain medical conditions, like if you have an ulcer, you may not be able to tolerate um, some of the side effects of these substances, even though they are natural. Or okay, so overconsumption will not be helpful. All right, so thank you for the likes. I hope we can have more likes uh, on this live, so that those who are supposed to still join in can join in. And we are talking about high blood pressure and hypertension. Thank you for the like. I really appreciate. I do not take this for granted. Um, If you have seen the WhatsApp link, let me know. It's on in my profile. You will be joining the WhatsApp group and we can interact more from that point. And if you want a more personalized interaction, we can get into that. All right. But I offer virtual consultations, and depending on your location, if you are um, around me, of course, you can definitely um, have a clear medical consultation. All right, so let's dive into this topic for this time. Remember, it's a question and answer session, and as much as possible, I'll be responding to your questions as they come in. And this may be general information, personalized, of course, but we have limitations to what we can say on this in this public domain. All right. So I want you to note that even though high blood pressure, which is can also be described as elevated blood pressure, um, may be described as hypertension, but a person may have high blood pressure and not actually have hypertension. Okay, I'm going to explain that. But the fact is that a person who has a diagnosis of hypertension definitely has had elevated blood pressure. So, hypertension itself is a medical condition. It's also being described as a metabolic disorder, uh, whereby there is consistently or persistent elevation in the blood pressure. Now, this topic is very crucial, very important because there are predictions that in years to come, more people are going to be developing hypertension. Interestingly, we're having more people in this time at this time, and in fact, younger people developing hypertension. And we can look at the risk factors for hypertension later. We could talk about that and some of those things. All right. So, but if you are going to talk about somebody saying, "Oh, they said I have high blood pressure, but I don't have hypertension." All right, so that could be a temporary thing that an individual was just checked. It could be a routine check, or they decided to check by themselves, or during a medical outreach or routine medical check in the hospital. Uh, they just discovered that they have elevated blood pressure. And I'll tell you, in fact, there are recent changes when it comes to uh, diagnosis, the values for diagnosis of hypertension. All right. Before now, it used to be like 140 over 90, 130 over 90. Once you have values higher than that. But at this time, even the American Heart Association is bringing uh, guidelines, new guidelines to say that when people begin to have blood pressure, if you as an individual begins to have blood pressure higher than 120 over 80, so if you are having uh, above 120 over 80, that's 120 of systolic and the diastolic greater than 80, then you should begin to consider your blood pressure as being elevated. So if you're having 130 over 90, 140 over 90, and in two readings, maybe at different times in the hospital, if you have these values higher than 130, 90, even though I've mentioned the fact that the values are changing. So you must note these values. So your doctor may decide to relate with the old guideline or even the recent guideline. But once your blood pressure begins to rise above 120 over 80, then you need to pay close attention. Very important. Let me know if you can hear me. Let me know if you can still hear me. I hope I'm audible. Please let me know if you can still hear me. Am I audible? Remember to double tap on your screen to like the live. I want to know if you can hear me. Please confirm that you can hear me. All right, so I'm sure I'm clarifying the question that some people may have. Some people believe that if they have repeated elevated blood pressure, and they call it hypertension, high blood pressure. But for your physician, once you have persistent elevated blood pressure, you don't just have, it's not just high blood pressure. High blood pressure or hypertension, depending on the term that is used, they're just terminologies. Okay, it means that individual has that medical condition where their blood pressure needs to be monitored and proper management given. Okay, so I believe that has been cleared. Now, I'll just talk about some of the important things that you need to know when measuring your blood pressure. A correct measurement of your blood pressure is very crucial, very important. Okay, because if there is in any way error, if there's a missing, um, if there's a gap in the measurement, it can lead to different things. Of course, if a person, an individual that has high blood pressure is being described or said to have normal blood pressure, the implication is that such an individual will not benefit, will not be given appropriate treatment, and the individual may even suffer complications, and then maybe too late to help. All right, so a correct measurement of your blood pressure is very vital, very vital, very vital. And if you are going to be talking about measurements, it's important whether you are already diagnosed of hypertension or not. Um, as an adult, you need to know that early morning measurements and then evening, night measurements are very important. Okay, a random check can be done sometimes, and of course, that can help to show the current states of your blood pressure, but the true reflection of how your blood pressure is being uh, run will better be interpreted using your early morning measurements or your night measurements. Okay, so I'll use refer to my notes for you to have a reliable and consistent reading that can be used even by your physician. You need, if you have ever interacted with a doctor, I'm sure um, you must have heard this or received this instruction to have a book. These days we can have recordings in your notes on your phone, you know recordings of your blood pressure. So your doctor uh, prefers that you have that measurement from home and then regularly at particular periods. All right, okay, the same way we'll talk about how your medication should be taken, preferably in the morning and certain times, so that there can be some regularity in your blood pressure. Now, because there are changes that occur in the body as I'm talking right now, if I decide to check my blood pressure at this time, it will be different from if or when I just woke up. It will be different from when I finish, just after I finish eating. Okay, so those are factors that can affect your blood pressure reading, even exercise. Exercise can also affect it. So the time actually matters. So it's not just about the internal factors, there are other factors, including your physical activities, your environmental factors. Do you know that stress, whether emotional stress, psychological stress, can influence your readings? I'm sure you've heard this before. Know your numbers, but those numbers can be influenced, can be affected by. Okay, I just need to confirm that I am audible. So let's have your questions. Let me know if you have any question so far from all that I've said. All right. So while we're waiting for more questions and then feedback from you, kindly like and subscribe to the channel. Remember to click on all notifications. After clicking on the subscribe button, usually you will see options for uh, personalized notifications, no notifications, and then the one that tops the list is all notifications. So kindly click to enable all notifications for the channel so that you can get regular updates. Thank you for subscribing and for enabling that feature. All right. So it's always good to check your blood pressure around the time that you are well rested. Usually the numbers are lower, usually when you are at rest or asleep. But during the day, the morning towards afternoon, you can have elevation of the numbers. All right, so what is recommended is that you check early in the morning and before you go to bed. So that way you're able to capture really the changes between the normal reading, natural environment, and then following following your activities, you can also find out the changes that must have occurred during your activities of the day. Okay, so there are some changes that usually occur with activities, exercise, eating, running, any form of stress can bring changes to your blood pressure, even change of position. Okay, so that's why sometimes your doctor may decide to check while you are lying on the bed or while you are seated and compare even when you are standing and compare these different values. All right. So no doctor actually makes a diagnosis of hypertension except it's in the severe state. Maybe numbers like 180 over 90 or over 100, 120. Those are high numbers. Okay, but if you have 130 over 80, 120, 130 over 90, your doctor would want to recheck, and that's the proper thing to do. Preferably, if you are rechecking your blood pressure, you should put between 1 to 5 minutes of a rest or break between checking. So two readings are preferable to confirm. And interestingly, home blood pressure monitoring may be more reliable, even though there is something called marked hypertension. And also, there is something called white coat hypertension. So, if you want me to explain that or those different terms, then you can let me know in the chat. All right. Um, so, what's the best time? I've said it. You need to check before breakfast, just after waking up, after your prayers, meditation. You need to rest and be sure that you are rested for at least 30 minutes, even though we say 5 minutes. But if you have done any form of activity that could have put some stress on your body, then you need to have good rest. So, other things that you should definitely note include that there are different machines that are available now. Electronic blood pressure monitors are now available. They are powered by battery, solar, electronically powered, but you need to be sure that you have a working blood pressure machine and you are sure that it's the right cuff that you are using. Very important that you're using the right cuff, and that cuff should cover about 80% of your arm. That's in terms of the diameter. Very importantly, So after getting out of bed, you need to be sure that you are well seated, your back well rested, your hand resting on the table at your heart level. Okay. So before you check, remember that even if you have a full bladder, and that happens um, most of the time, maybe when you wake up, you already have a full bladder. If you decide to check your blood pressure at that time, I mean, you may have elevation of your blood pressure. So it's important to empty your bladder, empty your bladder before checking your blood pressure. And then it's also important to check before taking your medications. Very important, because that will help you to know what exactly numbers are before putting in any form of influence. And then for the evening, you need to be sure that you are not checking around the times that you have just finished exercising, or you have just finished eating, or you have been stressed. So it's the time of 5 minutes rest is also very important before checking taking your evening measurements. So having the right cough, those are the things that you need to know. Having the right cough, um, taking the right posture, um, waiting at least 30 minutes after eating, and after exercise, emptying your bladder, 5 minutes period of quiet rest. There shouldn't be any form of talking when you are checking your blood pressure. This can affect the readings, can give a false elevation of your blood pressure. So you should learn to relax. Okay. You should have a good support with your back well rested, your feet flat, and then avoid crossing your legs. That can also influence your readings. What else? So preferably, you should take more than one reading, to 2 to 3 readings, and preferably have an average of these readings. So that will better give you a picture, real picture of your blood pressure. Now, if you have any question, kindly drop in the chat. The system is really helping to keep away some messages that are probably sensitive. I'm not even opening them because it's saying this message is held for review. For review. So um, I hope your message, a number of people have dropped messages about their location. So if you are just joining us, let me know where you are joining from. What time is it in your location? And do well to like and subscribe to the channel. I'm sure you will be finding the information that I provide here helpful. Okay, so we are talking about high blood pressure or hypertension. High blood pressure, hypertension. All right, so let me know if you have any question. Before I move to another part of this discussion, let me know if you have any question. Kindly drop your comments, your question in the chat. Once your message is community friendly according to the YouTube community guidelines, I'm sure I'll be able to see your comments. But if it is not appropriate, I'm sure I won't need to bother to check. Okay. So as soon as you join in, kindly double tap to like the live and subscribe to the channel if you are yet to subscribe, and then click all enable all notifications. That way you will be getting notifications on the activities of the channel. Okay, I can see Netapal saying, welcome to the live. Are you from India? Let me know if you are from India. Netapal Singh, are you from India? I can see that you are trying to ask some questions, but I'm not clear about your questions. Please reframe, retype. Doesn't seem to be clear. You're asking about what is LD and what is not LD. Hmm. Of course, there are some lifestyle practices that are healthy for you and I. All right. And I'm sure you've heard those at different times, but I'm going to give a reminder. Okay. And one of it is diet, appropriate diet. There's a diet that is actually appropriate and beneficial for every one of us. And that includes having a healthy plate. A healthy plate involves having 50%. If you look at the circle, 50%, like half of that plate being vegetables and fruits. And that should be a daily thing. And 25% of starch or carbohydrates, then 25% of protein sources like fish. All right. But some low fat, low cholesterol, low fat, very important. We still need some. All right. That is a healthy plate. So that dietary aspect is a decision, a conscious decision to living a healthy life. So eating healthy is part of living a healthy life. And another one is exercise, regular exercise. Interestingly, exercise has been proven to help with reduction of elevated blood pressure. Regular exercise, I mean moderate intensity exercise like cycling, jogging, moderate walking, brisk walking. These are important when it comes to living a healthy life. All right. Even losing weight has been found out to be helpful. Um, Losing 5 to 10 kilograms can even help to reduce the millimeters of mercury by about 10 to 20 when it comes to reduction in blood pressure. So these are facts. These are backed by researches that they are helpful for your health. Terrifier is here. Hello, Terrifier. Terrifier says, Doctor. Yes, welcome, Terrifier. Good to see you. Thank you for joining in. Where are you watching from and what time is it in your location? Terrifier, thank you. Okay, Sing says, yeah. I'm from India. Welcome. Kindly subscribe to the channel. I know it's morning now in India. What time exactly is it in India? Please let me know. Let's know in the chats. Sing. Then why my head feels light when I don't eat or drink water? Right. So your head can feel light when you don't eat or drink water. Yes. Your body is actually made in a certain way to function, okay, with the different parts, talking about the blood and different organs in your body. All right. So water is an essential part of man, okay, and many things that we do. So when you leave your cells dehydrated, um, there is little or nothing much that your cells can do, okay, at that time. So your cells need to be well hydrated. They need to be well hydrated. They perform better. Your cells are able to function in a particular physiological environment. So when there is lack of water to help them to function, in fact, even your blood, the flow of your blood can be affected by uh, your level of hydration. So if you are well hydrated, you can be sure that your blood circulation will improve and will be better. So the body, now let's talk about your brain. Your brain needs oxygen and works with nutrients that has been supplied from your blood. So if there's any gap in any way, if anything affects the flow of blood, the physiological nature, normal physiological nature of your blood, then that can affect your brain. Okay, the same way, if there is lack of nutrients, the level of sugar that you need to have, different organs in your body need uh, nutrients, oxygen to function. So once you are depriving your body of this, your head may feel light. So it may be from low blood sugar. Okay, your brain begins to sense that there's something missing. There's not something that is not enough. Okay, and that way is like a signal, it's a symptom that you need to address immediately. So hydration is very important, and eating right, like I've said, most people eat uh, because they are hungry. Most people eat because they are hungry, but really you don't need to wait uh, before you eat. Wait till you are hungry. I actually did a video on 10 healthy habits that you need, whether you are in your 20s, your 30s, your 40s, 50s, or even your 60s. And that is part of it. You must have regular times that you are eating breakfast, lunch, and your dinner. Taking breakfast appropriately in the terms of proportion, in terms of the timing, very important. The key aspects of your health, and the fact that you're going to be working during the day, through the day, you need that level of energy to be boosted, your level of energy to be boosted for you to be able to function well. So if you are doing a lot of mental work, even physical work, and you are low on sugar, your body will try to compensate. But if the store is depleted, then you will have some symptoms like a headache, lightheadedness. Some people may even have dizziness, and then they may even fall and go into a coma. Okay, so that's how bad it can be. So we have to be consciously taking care of ourselves, doing the needful, and that's what I'm encouraging you to do. So I hope I've been able to answer that question. Netapal says, yeah, I'm from India. It's good to know how is India today. What part of India are you watching from? Have you liked this live? Remember to like the live. Sing. How old are you, please? If you don't mind, Netapal, sing. And Terrifier, um, please, if you don't mind, what's your range of age? Because if you say your blood sugar, I'm reading your message now, sir. My sugar is 4.3. You know, when you say 4.3, the 4.3 millimoles per liter before meal in the morning, is that normal? Okay, so if it's 4.3 millimoles, I'm going to do a calculation to confirm in milligrams per DL. Okay, so for you, um, 77.4 milligrams per DL. Okay, that's not bad. That's not bad. Okay, but it shouldn't start falling to 60 or 50. Okay, that can give you some hypoglycemic symptoms. All right, but 70, moving close to 80, 90 is fine. Okay, so there shouldn't be any problem if you have that reading before meal. It's fine. Terrifier, I hope I've been able to answer your question. We will definitely find a time to talk about blood sugar. Hypertension is what we are really focusing on now, but any question is welcome. But we will have certain days for discussing certain topics like diabetes, for example, or management of blood sugar. I'm not going to be bothering myself opening some messages that have been held for review. Possibly, the system is helping to actually keep some help with sanitizing the live stream. So people that have been here, people that are here, Terrifier, Neil Mirez, Caesar, Chima, Amadi, Tommy. So thank you for engaging. Okay, Terrifier says I'm 32. I think we have met before many times. Seems you've been on my live. I subscribed right to the channel, and then maybe on some other platforms, on some other channels, we've met during live streaming sessions. Okay, so but definitely, yeah, familiar. And I have a shooting. I'm reading your message. Terrifier says I have a shooting pain on my left side neck. What can cause that, doctor? Okay, so I want to say that most people that I expect to be benefiting from this include people from the age of 18, upwards. As adults, I'm sure that we all need this information, no matter your age group now. As an adult, we need to work with this information and do appropriately. I have a shooting pain on my left side neck. What can cause that, doctor? I mean, it could be anything from Maybe you had a trauma to that side, you have an infection. Um, is there any swelling around that place? Those are questions that we want to ask. Any swelling, any cough, you know. So you say shooting pain on your left side neck, what can cause that? It could be anything. So you will definitely need to see your doctor if this pain is something that you cannot bear and it's persistent. It's not abating, it's just there. So you need to find out from a proper evaluation your doctor. The doctor will not just ask you questions like I've tried to ask, but we'll also examine, we'll touch, that part of your neck and examine you generally and make necessary recommendations for investigations. Okay. So sometimes pain in the neck could be due to posturing commonly. Okay. There's something called cervical spondylosis, and it's usually related to age, um, posturing, especially depending on the type of work that you do. Then in this technological age, where we use phones, most people use the phone bending, watching, scrolling, and doing so much. But if you take correct posturing, as I'm seated right now, I have a pillow at my back, and that is giving me some support to be able to help avoid the pain that may come from prolonged sitting. Okay. Normally, within an hour, and I've just gone into an hour now of sitting, one is expected to stand. Okay, so I'm going to do that and stretch myself for a few minutes um, as I continue this. Okay, so the neck pain could be from posturing. It should be a common thing that if you have a particular way that you posture yourself, whether sitting or standing, when using your phone or other electronic devices, that could result into neck pain. That's a general musculoskeletal pain, and it could also be from sleep. Maybe you sleep with a pillow and or you sleep in an abnormal position. That can also be a cause. So this is just a general explanation for causes of neck pain. Of course, it could be to the extreme for some people. It could even be meningitis. So anything could cause a headache. All right. I mean, a neck pain. Pardon me, a neck pain. Okay. So it's good to know that you're an adult. Terrifier. Please, have you liked the live? Kindly double tap on your screen to like the live. And, of course, if you can, share with others so that they can also benefit from this information. Terrifier says, yes, sir. You answer my question. I'm happy. Good to know. I'm glad to hear that. So you are welcome, Terrifier. And then they say your blood pressure is 135/88 most times for me, and you are 32. Okay, I think I was also asking about your body mass index. According to the American Art Association, now they're saying that it's better to start treatment from 130 80 or 130/90. Okay, if you have those values. So elevated blood pressure now, to them normal blood pressure is less than 120/80. So once it's 130/90, the recommendation is that you start close monitoring. And of course, it doesn't mean that you're going to be on medications straight away. It may just be that you need to start some lifestyle modifications like your diet, changes in your diet, reducing sodium salts consumption, increasing potassium containing foods like banana, and vegetables, um, other fruits. Then exercising, very important. We also need to avoid alcohol if you take alcohol, stop smoking if you smoke. These are factors. And if you have any stressful work that you are engaged in, you need to uh, balance work life. So, pain from a knitted disc, pain from the neck can also, any form of pain can elevate your blood pressure, you know. So, if that's why sometimes the doctor will want to treat you for pain, and once the pain subsides, some people have that temporary elevation of blood pressure during pain, but once the pain subsides, I mean, the blood pressure gets to normal. And those are also occasions where you can say person has high blood pressure, elevated blood pressure, but they don't have hypertension. Okay, but once the reading consistently reading above 130 over 90, then such an individual can be said to be having hypertension. And people don't want to hear this. There are some ways people think and talk as a doctor, and I understand the fact that nobody really wants to be uh, named with a medical condition. Um, Nobody really wants to take medications, and when it's actually being said that it is to be taken for life. Okay, so it puts a lot of pressure on people's emotions and um, the psychological effects of knowing, getting a diagnosis, and having to spend time and years um, monitoring that condition. All right. So, but I'm going to be sharing some of the things I've heard patients mention, some of the things patients have said, and I need to clarify some of these things. Of course, you need to know that hypertension, like diabetes, they are non-communicable. Hypertension is not communicable, so it's not something that you can get by touching another person. You know, it doesn't happen that way. All right, so it's a non-communicable disease, and it's one of the most common, and billions of people are living with hypertension. Many are undiagnosed. It's actually been described as a silent killer. Many people are undiagnosed, and for those that are diagnosed, not many have been started on treatment. And for those on treatment, uh, some are not even consistent or regular with their treatment. So these are important points. So if you know anyone that is being managed for hypertension, they need your support. You need to understand that it doesn't really actually feel good. Okay, some people have been able to overcome initial shock of having that diagnosis, but over time they've learned to do the needful, and then that helps to prevent complications. Okay, with proper follow-up and proper um, uh, lifestyle changes, very important, and that should be consistent. All right, so Terrifier says I have lots is stress too, sir. Okay, you mean you have a lot of stress and you're surprised your blood pressure is 135/88. Expected it to be higher. All right. So sometimes so many other factors. Elevation of blood pressure is not just because of one factor. There are multiple factors usually involved. Increasing age is a risk factor. Race is a risk factor. What else? Weight. I mentioned that it's a risk factor. Other comorbidities like if an individual has diabetes mellitus or even high levels of cholesterol, such an individual also is at risk of developing hypertension. All right. And then um, the level, your ability to cope with stress is also a factor. So some people are able to cope well, others bend under pressure, under stress. So if you're having 135, 88, if you follow the recommendations I've given about measurement, and you're having 135, 88, you know, that may be a little high, but it can be managed, first of all, with lifestyle changes. All right. And if you've been checking around the times that you are stressed, then it may just be uh, false reading that you may need to now apply early morning checks and evening checks to be sure. Then see your doctor for proper evaluation. So Terrifier says, okay, sir, thank you for the information. And welcome, Terrifier. Okay, I can still see you're sending messages. Keep your message. Okay, let me know if you can hear me. Please let me know if you can hear me. I will be making some movement so that I can stretch myself at the same time as I'm talking. I've been sitting for about 1 hour now, so it's important to stretch, take a walk, move your joints, avoid sedentary lifestyle. That is the new smoking. So I will try to respond to your messages. Okay, Terrifier says I have that's GF girlfriend problem. So she stresses me out and we fight a lot. Okay, so like I was saying, definitely stress is actually your body's reaction, your response to an unpleasant situation or experience. And so many things could be responsible for that, including physical factor, um, psychological, emotional factor. It could be work related. It could be financial. It could be a financial factor. So, but in this case, you're talking about um, a relationship factor, emotional factor. All right. So I don't know your GF, and um, I don't know much about you. So we have different personalities and different backgrounds. So these are things that actually influence how we think and the way we act. Okay, so there's a book by Timai, why you act the way you do. Okay, so that's one book that talks about temperaments and all. So you need to understand that as a foundation, that we have different backgrounds, different experiences, different relationships that also influence us. Now, you need to be clear with your relationships. You need to define and be sure that um, you should be in relationship with the person you are in relationship with, and then the purpose of the relationship, Okay. Are you planning to get married to this person? Is it a communication issue? What exactly do you mean by she stresses you out? Okay. What causes the stress? What exactly makes her uh, want to stress you? Okay. If that's intentional. Okay. Or she's not intentionally stressing you, but doing things that actually cause stress. Then you need to look at it from your own side also. What's your own contribution to this stress? You have to be sincere with yourself. Okay, so I hope you can hear me, Terrifier. I really hope you are following this. Um, just important information or communication to you and to everyone, because relationship matters really matter, and they can actually also affect your health. Okay, if you have a thriving, peaceful, pleasant, exciting relationship, it will definitely make a mark on your health also. Okay, your emotional health, your psychological health, and even your physical health. So you need to identify the factors around the stress. What are those things that actually trigger the stress? And you need to learn communication. So for emphasis, I would say learn to communicate. You must learn to talk to each other about things that matter to you. Okay. So I don't really know the cause or what you mean by she stresses you out. And you may actually benefit from seeing a counselor so that you can relate better with the experiences that you have, and the information can be better. Okay. And if you can, check my profile. I put there a WhatsApp link. You can join the community. And if you need a more personalized interaction, you can definitely um, get access from there. All right, Terrifier, I'm sure you can hear this and respond appropriately. Okay, so it's not good to fight. Okay, the kind of fight I mean, fighting each other, fighting one another. Okay, but you need to fight for your health. You need to be proactive, and you need to take some stands to show that you are committed to yourself. You must love yourself. You must let others know that you love yourself and you are willing to um, give yourself the best. Really, is because in doing this um, commitment to yourself that you can actually help others. You can help others. Now let's look at on the last phase of this discussion, this session. I will be talking about some things I've heard our patients say. Some of those things initially were shocking. Later, I found out that this is really common among individuals or patients. Now, I've seen patients who have said they didn't take their drugs before presenting to the clinic because they were coming to see the doctor. All right, so but that's wrong. Okay, the fact is that your blood pressure, like we have said, fluctuates with changes in activities. Okay, and no one can predict at what point. Some people have had levels of blood pressure that are not as high as some other persons that have developed a stroke. So we don't know at what point the elevation can lead to a serious complication. So you don't want to take chances. So taking your drugs before coming to the clinic should not be a sin, except you have an instruction from your physician, uh, except you have noticed or you have measured your blood pressure and it's in the hypotensive level. Okay, so if not, then you should take your medications even if you are going to see your doctor, especially talking about your um, oral antihypertensives. I hope you, I hope you can hear me. Okay, so that's that point. Then some people say, "Oh, I don't take my drugs when I've not eaten." Okay, that's also wrong. Talking about medications for your blood pressure. The fact is that even if you are going for a surgery, your surgeon will prefer that you have your blood pressure well controlled before going to any operation on your body, because that can lead to heavy blood flow, heavier than normal, if your blood pressure is not well controlled. So, not eating should not affect your BP drugs. Most times, little water is even encouraged, little with your medications on a day of surgery. If you are doing a surgery, of course, you follow your doctor's instructions, but because food does not really affect these medications, okay, not eating does not affect. So you should take your medications even if you want to take them before meal, all right? Because stroke does not depend on whether you have eaten or not. Take it. Okay. The third one is that some people say they take it occasionally. So why take it occasionally when the recommendation or prescription says take it daily? So if there's going to be any change, let it be because there is an observation of hypertension, or you have had a drug reaction, or your doctor has communicated that you should um, not take your drugs at that time. So take your drugs as prescribed. Taking it occasionally is not good enough. You should take it daily or as prescribed by your doctor. Somebody says, "Oh, I take it, I've been taking it regularly." But when you ask, when was the last time you took your drug? Did you take it yesterday? They say, "No, no, no, I can't actually remember the last time I took it." So you need to deal with that lack of consistency in your medications. If you are taking medications for hypertension, then you need to also note that there are some things that you may be engaging in taking that may affect your medication. So there may be some drug interaction, and you need to watch out for this. Some people say I took something, so I didn't want to take my medications with that. So that thing that you are taking, is it really healthy for you? Is it working uh, for your blood pressure control? And all. So always present anything, be it supplements, whatever it is that you have or you are planning to take along with your medications. Let your doctor see and then give you proper counsel on that. Sixth one, maybe just three more points. The sixth point says, I don't know the name of the drugs. Okay. Sometimes some people get their diagnosis from another center and commenced on medications, or even from the same center, but later, while interacting with a new doctor, they talk about not knowing the names of the drugs they are taking. This is not good enough because if, for example, there's a case of an emergency, there's a need to know what medications an individual are taking or is on. So, not knowing the name of the drugs is not good. So, you can always ask your doctor or your pharmacist for the names of the drugs that you are taking, and you can read them yourself. And if you have any challenge reading them, someone can interpret to you. Two more points. Someone says, "Oh, I have stopped taking my medications because I don't know what can happen if I continue taking them." Okay, so the way I will respond to that is, hmm, you also need to know what can happen if you stop taking your medications. Okay, so that's when we can talk about the symptoms that some people begin to feel: headache, palpitations, chest pain, dizziness. Some people may already even start having complications like heaviness in a part of their body, limb, speech problems. So talking about complications, kidney problems. So if you know that not taking your drugs can lead to complications from uncontrolled high blood pressure, then you should take your medications. All medications have side effects, and if you have any challenge, any effect that is unpleasant, arising from your use of certain medications, then you should see your doctor for proper adjustments, for review of your medications. So that's that. Finally, people say, "I know when to take my drugs. I know. So I take it anytime. You just take it anytime." No, no, you don't know. If you know, really, it's better that you take your blood pressure medications, around that time when um, there seems to be possibility of increase in the numbers. Talking about waking in the morning to moving into the afternoon. Okay, so it's better to take in the morning rather than just at any time. Okay, that consistency is important. Regular times that you take your blood pressure medications. I hope somebody has been able to learn one or two things from those different uh, different experiences that people talk about when it comes to using their medications and then seeing their doctor talking about this. All right, so I really want to say thank you for tuning in and watching. And if you are just coming on, uh, it's not late, but we'll be closing soon on this session. And it's been an interesting session, launching this question and answer session. And I'm sure it will keep getting better as we uh, continue in this. I'm looking forward to seeing you again uh, on another session. And if you can, please share with others so that they can participate also. And I'm sure that we will be getting appropriate um, answers to our questions. And God is our help. So I really appreciate everyone who was able to join in. I do not take your presence for granted and for engaging, in the chat. If you didn't join, I mean, there was little or nothing I could have done, but the fact that you chose to not just pass by, but to engage really means a lot to me. So thank you once again, and I will see you again soon. If you are able to watch the replay, if you missed out on any point, you can always watch. And if you have any question, any comments around the things that we have discussed, you can definitely put your comments in the comment section. Thank you once again. Hopefully, if you have not watched videos that I have on the channel, videos on hypertension, then do well to check on those videos, watch them, and let me know what you are able to learn from them. Thank you. God bless you. Bye for now.